So welcome to Injuries and Evidence, the podcast where real life injuries meet real life science. And today we have with us an amazing guest. We're excited to have him here, Dr. Ted Kyle, and with RAYUS Radiology. And again, I'm your host, Dr. Brandon Carter. You guys know me. And we're happy to have you here on the show today.
So happy to be here. Thanks.
Cool. Thanks for being here. So we were just talking a little bit about this T-shirt. So we're going to start with that because this is cool. I think this is when you guys went 3T on your MRI world.
It was
right?
Yeah, it was a marketing move. We bought a 3T magnet, which was a big deal to us at the time because they were rare. And we were the first outpatient center in Utah to have one. And so it was a big step. Yeah. And so I thought we needed a shirt for it, hence that shirt.
Hey, and I think on the back, it says US MRI. So that was like when you guys were.
Right. US MRI.
So there's not a lot of these T-shirts around. So how much is this one worth?
I hope it's worth a lot. That's my hope. Anything old school, that's good.
Super cool. Well, I met you. Let's dig into the background a little bit. I met you so I've been in Utah for how many years now? 17 years.
Yeah.
And I was kind of up your way in South Jordan back maybe 15 years ago.
Right.
16 years
I
ago.
remember.
And I think, was that your only US MRI was in South Jordan?
Original center.
Yep. Wow. So you didn't have anything else after that? Wow.
I mean, up to that point, that was our only one. Yep. That long ago.
So that's where you guys started.
Yeah.
So let's dig into that. Tell me a little bit about your background, because there's a few things that I don't know about you. You're kind of like, I don't think a lot of people know about you.
Oh.
So you're Dr. Ted Kyle.
Yeah.
So where'd you go to school? What was your background
in that realm?
What even led you into the chiropractic world?
Oh, I mean,
Let's go way back.
Undergrad was a path. I mean, I went to several undergrad schools, Arizona State to start. I'm an Alaskan, so I come from there.
Oh, really?
Originally.
Okay.
Yeah, and went to Arizona State.
That was my next question. So you were born and raised?
No, my dad was military, so I ended up in Alaska at 5 years old.
Yeah.
So that's what I remember as far as, at 5. Alaska is what I remember as my childhood. So yeah, I grew up there. Great place to live back then. Very rural, very
wow.
Very, very remote in those days. There was before internet and everything else. So
yeah,
it was an interesting childhood, but super good. But went straight out of high school to Arizona State, which was the shocker because I'm going from Alaska to Arizona State, which is in Tempe, outside of Phoenix, and the shocker was the heat.
Okay.
And Alaska boy going into this 115 degree weather.
That must have been like life changing.
Yeah, I wanted to get out of Alaska, and I went really
far south. You did want to leave Alaska, though.
I did. I wanted something new, and Alaska's known for its brutal winters, which are truly brutal in lots of ways. But it was a good start out of high school. Shocking temperature. I went to Arizona State for a year. Decided I didn't want to stay there.
Yeah.
And then I ended up at University of Utah. Eventually for my undergrad.
Okay.
And then of course professional school after that.
Yeah.
Which same path as you. I went to Parker.
Did you go to Parker?
In Dallas, Texas, yeah, for chiropractic. I had a lot of interest in the field, and great education there. Was super happy with it.
Parker has tried to get me to teach there so many times.
I'm not surprised.
I keep getting emails from them.
Are you?
We're looking for instructors. You should do it. We're looking for spinal structural biomechanical instructors.
Oh.
Please help.
Yeah.
It's funny. Anyways.
You should take a job there. Can you do it virtual?
I would do it if we could do it virtual.
Yeah.
And if they ever listen to this, then hey, I've sent them so many replies. Like, I wouldn't mind being adjunct.
Right.
And just part-time or whatever.
Yeah.
And do more of a virtual training. I think it'd be awesome.
Mm-hmm. Yeah, you should do it. Yeah.
So you went to Parker, and then
Parker.
After that, where'd you start?
Landed here.
So came to Utah then.
Yeah, interestingly, I mean, briefly, I went back to Alaska post-grad because I had an idea that I would want to practice there, and I went back in the winter, and I was like, no, this is not where I belong. So I hadn't been there for a good 8 to 10 years after all my education. So landed here and actually acquired a practice that was running, and quickly realized that, I mean, within a year I was like just super, I don't know, I was not happy with the resources for imaging, honestly, on my patients, right? Advanced imaging, MRI.
Sure.
And this was 20 years ago.
I was going to say, how long ago was that? So what
20.
year are we talking? We're talking like
This is
beginning
90s.
of the new millennium then. So late 90s?
Late 90s is when I had the epiphany, and then early 2000s is when I started when I went down the path of I hired a radiologist who had a fantastic practice but was kind of closing shop. He wanted to retire, but really taught me a ton. And together we had this idea of doing doing an imaging center. And
wow.
Yeah. And so it started out as Salt Lake MRI back in the day.
That's what I saw. I did see Salt Lake.
Yeah, that was our original.
I remember that, like seeing some old records and stuff, and I'm like, Salt Lake MRI.
Yeah.
I think that's Dr. Ted's
first
one, and then it so was that in South Jordan, or was that in another
South Jordan?
South Jordan.
That was our site.
So it was Salt Lake MRI first.
Yeah. We bought an old machine. It was old then. It was an old MRI that was, I don't know. I'll just say in the world of MRIs, it was a pretty beat up machine, but it was enough to get us started, right? You're buying everything on a credit card back then, and just
I gotta hear though. Like, how much money was that? Just out of my curiosity.
I actually don't remember.
Do you have any recollection?
I think the machine. I mean, if I had to guess, I think that machine was like $300,000.
Was it really?
Yeah, but in today's world, those machines are over $1 million now, right?
Yeah,
so
I bet
it was not new at the time. A really interesting thing.
That's a huge that must have been like the risk in your mind. You're thinking like, whoa, I'm going to put $300K into something.
Yeah,
we better be ready to kick some butt.
Yep. Yeah, it was a lot of risk.
No pressure.
A lot of sleeping at the imaging center at the time, and making sure. Yeah, it was my life. But you know what's funny is that machine, actually, I just retired it a month ago.
Really?
So it's been with me all that time.
It has lasted that whole.
20 years.
Oh,
plus.
That's cool.
Yeah.
That's really cool.
Yeah. So it got put out to pasture more or less. Yeah. But I was very connected to that. I mean, we named it.
I bet.
Yeah. Had a name. Her name was Betty. We always called her Betty. So
Big Betty.
Still to this day, I think we have, how many machines we have locally? Like 12. And that was still my most. Cool. It broke down less than any other imaging.
Really?
Yeah, device that we have. It was very, very, very reliable.
What was that, like 1.2 or was
it was a 1.5.
1.5.
Yeah.
Was it really 1.5?
So it was traditional.
Wow.
Yeah.
Dang.
That was good.
So that is good pricing then for picking
probably
up that thing.
It was pretty beat up though. I just remember.
That's super cool.
It was beat up.
And then it was then you transitioned to USMRI.
We morphed, and the reason was,
I remember that. I mean, that was when
we changed.
You were USMRI when I moved to Utah. So.
Oh yeah. That would have been.
Because I came here in like 2008, 2009.
Yeah, I was going to say 2009 we changed our name.
Yeah, I think it was 2009 is when I still hadn't been to South Jordan until.
Yeah.
I think you just started USMRI.
Yeah. We wanted a name that was a little more reflective of what we were doing. Salt Lake MRI felt very Salt Lake only. Yeah. And we had just started working with the Olympic teams. And at the time.
Done a lot of that.
Yeah, it's still a big focus of ours, but we were drawing a lot of international athletes into the state that were coming to see us, and we felt like Salt Lake MRI wasn't a good reflection of what we were, so U.S. stuck. And we carried that name for a while.
That's cool. Yeah. I liked it. Well, I still have the shirt, so
yeah, I'm glad.
And I still like the USMRI.
Good.
And then you had the transition to RAYUS, so that happened
5 years
When
ago.
was that? Is it about 5 years now?
5
2020?
years. Yeah, I can't believe it actually.
So kind of COVID time, huh? That's right. I
Yeah.
do remember that.
Yeah, it was COVID time. Yeah, we had 5 centers at the time before we
Okay.
did the merger. Yeah.
All
Yeah.
right.
Yeah.
And then what's your position now with RAYUS?
So officially, it's a long title. I'm senior vice president of strategic growth, which is a mouthful, which means I help the company grow nationally, I guess.
Okay.
Yeah, like in new initiatives and new technology, all the cool stuff.
You're like the perfect one for that, though.
I hope.
National
We'll
growth.
see. I hope everybody thinks that. It's
you
fun.
are.
It's a good job. It's fun.
You definitely are. That's like your world.
Yep.
And then, so then that was 2020, and then now we're heading into kind of a new avenue here of
We are.
you're opening up and you're transitioning. I mean, the same South Jordan location. You're transitioning the name. I saw.
Yeah. Yeah.
So tell us a little bit about that.
So
what was your epiphany on that one? Instead of 1990, late 90s, of starting an imaging center, now you're like, okay, we're going to actually switch a center over.
Yeah. Yeah. So we, right now we have 9 centers in Utah.
Yeah.
And I went to RAYUS last year and I said, I have this idea. I need one of the imaging centers. And they're like, pick one and you can have it. And so I picked my original because I felt connected to that place and I wanted to convert it.
I bet you did.
Yeah. And what I wanted to convert it into was a model that was much more, I call it patient-centric. It's no mystery that healthcare is difficult to navigate for patients now, and the trend we've seen much more so in the last year or two, but over the last I say 5 to 10 years, is that there's a lot of denial on the healthcare entities not letting people have access to imaging. And so what we wanted to do was create a model where a patient has the ability to choose for themselves if they're going to get imaging at an affordable rate that's much lower than they would pay from an insurance plan or a hospital, etc. We made it very affordable. We wanted to give them access and the feel like they were in control of their health care. If I feel like I need to have a neck MRI because my neck hurts, I can go here and get it done. I don't need a physician order. I can just order my scan online.
Okay.
Again, for an affordable rate, and go have it performed, and then after the fact, I'm going to get a report sent straight to my phone if I want that deciphers or basically shows me what every term means with pictures, so I understand what that report is. It's not like, it's not like a foreign language when I look at it. And then we have a nurse practitioner that's just fantastic, who's going to sit down with the patients and go over the report and explain everything.
Really? Wow.
So a little more personal touch.
Yeah, I like that.
And then they
Do you know how many times? I can't tell you how many times with all the record review, especially MRI side with PI Sciences, because again, we get patients from all over the place, and it's just different case, whether it's cases or just traumatic injury, and it's not even an open claim or anything on it. They still call us and ask questions, right?
Yeah.
And a lot of them have MRIs, and they say, I had no, I just did an exam a week and a half ago, I'd say. I did an exam, and the patient said, I had no idea I had 3 disc herniations in my lower neck. And they're like, one of them was extruded disc, and it was actually coming out, and it almost looked like it was really sequestered. Bad. So I pulled it up, the image from RAYUS, and I was looking at it with him, and I'm like, ooh, actually, so what treatment are you getting? And he said, all I've had is 1 injection, and it was a year ago. And I said, ooh, man, we need to send you to a different type of physician, number 1. Number 2, and he's sitting there taking pictures of his images, So anyways, keep going, though. So sorry.
Yeah.
But I think that happens a lot.
It does happen a lot. And one of the things that just really bothered me was that you have healthcare organizations dictating, your ability to have, imaging on something that may be bothering you. The trend is really that it gets denied right, from the healthcare. They don't necessarily want to pay for it, or they say you need to go and have 6 weeks of treatment like physical therapy or chiropractic, and then come back, and then we'll see if we'll approve it. And then we still are seeing that they don't approve it. So you're asking a person who is suffering, you need to wait 6 weeks, and then we'll decide if we're going to allow it. And then maybe even when you get to that point, we still may not allow it. And again, these people are in pain or suffering or have some kind of a mindset that something's wrong with them. So why not give them the answer right away? And that's our goal, is if you want the answer, and then you're a decision maker now. You're the patient. Let's say I'm the patient with a herniated disc. Now I know what is wrong with me. Now I can make a decision. Who do I see to correct this? Because I have the information. I'm doing it almost backwards, but the reality is you're doing it the correct way. Before I even see a doctor, I know the kind of doctor I need to go see, right? Based on what we're finding. So, the name of the company is Viv Radiology, and Viv in Latin means longevity and health and life, and that's kind of the idea behind the whole thing. Is we want longevity for people, and I'm a huge proponent of being really proactive on your health, trying to determine if there's anything going on. We'll do whole body MRI there, which is new, where we have the ability to scan the entire body and look for things like cancer and things like that. And again, at an affordable rate. We don't want to charge people a lot of money. We want to make sure they have access. We don't want barriers. And sometimes money is a barrier. We don't want to charge so much that it doesn't allow a lot of people in. So we want to make it work for everybody.
Wow, that's awesome.
Yeah.
And I've seen so many of the patients that are coming in, and then they're asking, hey, I need a referral. Like I had to send out a fax this morning. I need a referral for this imaging for my insurance to cover it. And it's kind of sad. And I also had a insurance company call me recently and said, let's see, the patient was injured 2 weeks, I would say 2 weeks before my exam with the patient. And then they had radiculopathy going down one arm in a dermatome pattern. And I said, it seems like, and there were positive orthopedic tests indicative of disc herniation. And, and the severity of the pain was like an 8 out of 10. It was like severe pain, decreased range of motion. I mean, everything was documented well. They still shot it down. Even like I ordered the MRI, and it still was, so 2 weeks after the injury. And then I had seen the patient for about 2 weeks. And I said, so it had been 4 weeks out since the date of injury.
Really?
And then I said, well, you need to go get an MRI. Yeah. Because pain was progressively worsening. And it actually was like, this is getting really bad. And it was like, you need to go, we need some more answers. Right. And the insurance company called and just totally shut the friggin' thing down. I was so pissed. I felt, I don't know. I didn't know what to do, to be honest. What do you do in that situation? I mean, is there any way to even discuss it with an insurance company? Like, hey, you guys need to pay for this MRI for this patient because I have enough documentation on it. Yeah. So,
I mean, I think there's I know there's advocates, and I'm not trying to completely disparage healthcare, because honestly, those insurance companies are trying to do a good job, but they do peer reviews. Sometimes you can get on the phone with these peer reviews and talk it through with them. And then even if they get around to approving it, it's still it's a time factor, and that's again one of those things that just pain is such a personal thing, right?
I want to know where the 6 weeks comes from, though. That kills me, and that's where she's
standard now.
Yeah, it is standard.
Standard is a six.
And I've seen that for years and years.
Yes.
And then that's what they were trying to come at me, like, well, Dr. Carter, you didn't wait 6 weeks. And I'm like, well, what the hell? What if I sent it in yesterday, on 5 weeks and 6 days, and are you still going to reject it? I mean, deny the claim? So anyway.
Yeah, you don't know. You don't know what's coming down. And again, I where I was going with that was like, because pain is such a personal thing, and most people have experienced pain. it's frustrating because you can't get away from it, right? And it's always there. And when you make people wait, it just doesn't make sense to me. When there could be an intervention that could happen once you get some answers, you know. And it applies to the preventative thing too, like with the whole body MRIs. You know, why not detect cancer early when you have the technology to do it, and you have the ability to scan somebody, and it's pretty effective in finding possible issues. We're also going to do breast imaging, advanced breast imaging, so MRI,
good,
which is the most effective.
I don't think I've heard of that versus.
So mammo is what they consider gold standard, but far less effective at detecting cancer than MRI. But MRI, because it's expensive, is denied by insurance companies a lot of times because of the cost, and so they go to mammo, which is not as effective. So we want to open access, so someone can just call and say, hey, I want to get a screening for using MRI for breast cancer.
Wow, awesome.
So
cool. I love that.
The thing we didn't want to skimp on, because a lot of times, you know, maybe there's imaging centers that may throw, be a shop where you can go and get a discount. But at the same time, they may be using, I'll just call it substandard imaging equipment. Old stuff. We wanted to go the route of latest technology imaging. We have a 3T there, which is the highest, the most advanced MRI you can get right now, and we wanted to make sure we had the best of the best for the patient. And I can say that about the radiologists too. The radiologists that are involved in this project are our best radiologists. Who are very skilled, and they're excited to bring this to patients.
I drive your radiologist crazy.
Dude, you ask a lot of questions and check. I admire that.
Everybody knows that.
I think people don't do that enough. I think there should be rapport between the referring physician and the radiologist, and if there are questions or if you feel like there's something that they need to have a second look at, the best radiologists are so open to that. Yeah. And believe it or not, they enjoy speaking with you.
Okay,
good. They enjoy when you will come back and say, take a look at this, because then they know you're looking at the images and the report. And
don't you wish all chiropractors would
I wish everyone did that. Yeah. I'll admit that's time consuming. It's much easier as a physician to just get a report and look at it. It's a much longer step to actually pull the images up and start looking at them as well. And I do wish more people did. And there's definitely a lot of physicians that do. But then there's a subset that just look at the report.
There are, and oftentimes, and everybody knows with PI science, with all our training and everything, that if you see disc herniation, please add the diagnostic code into the case, because they never do. It's I've seen M99.01, M99.02, segmental dysfunction of cervical, thoracic, lumbar. Then they get the MRI, and there's severe disc herniation. We're going to refer out for surgery, and they don't change the codes.
Yeah.
It's come on, update. It's a working diagnosis with every type of. We deal with injuries, right?
Yeah.
All the time. That's our expertise.
Yeah.
And it's and if you see that, then come on, friggin' update the code.
I agree.
So that the insurance company, because claims adjusters are always right, because all they're going off of is the paperwork they cross their desk. They're not making any. They didn't do an exam. They're not. They're not coming against you in any way. They're just going, hey, the paperwork says segmental dysfunction, which is a 2 to 4 week treatment plan, maybe, versus a 2 to 3 year treatment plan for disc injuries.
Right.
Change your codes.
Yeah. It's easy.
It's very easy.
It's very easy.
And that's, man, I don't know. I was talking to a physical therapist again the other day, and they struggle in PT big time with MRI. They're not doing, they don't update anything. They don't even look at the pictures.
Is that right?
And the physical therapist that I was talking to, brilliant man, and he's into trauma and traumatic. I think he said 70% of their practices are personal injury patients, and he said Yeah, they don't ever review the MRIs.
Mm.
I said, well, that's what we need to change.
Yeah,
It's time to make a movement on it, though, where physicians are doing this in the personal injury world.
I agree.
Traumatic injury.
I totally agree with that. Yeah.
And when they're using companies like yours, it's like, hey, pull up the picture, look at it,
yeah,
and review it with the patient. And if they have any kind of a fear of, because they're like, hey, I don't really know how to read an MRI. I've been in practice 40 years, and I never looked at. There are some amazing courses you can take online. In 5 hours, you'd be updated. You'd be like, oh, I see. It's so quick.
It's easy to get the education.
It is.
Yeah, yeah.
And they just have to jump on and do it.
You're going to be super excited about our new product. This is outside of Vive, but the project we've been working on with
I don't think
with a measuring tool that uses AI, FDA cleared for flex extension.
I don't think I have.
You don't know about this?
Don't think so.
Oh, yeah. Maybe that's a different podcast, but it's getting close to being released. So there's a company out of Texas that's been working.
Oh, you did mention that in passing, though.
Yeah.
You were like, I need to tell you a little bit more about it.
Yeah. It's going to be it's a game changer. But AI driven for measuring, and it's FDA cleared. So FDA cleared the measuring part of the AI, which is difficult for a company to get. They're the first one ever. And it will measure to a level for intersegmental instability to a level that no one ever has before. It's extremely accurate. So there'll be no question about the measurements.
About the measurement on it.
Yeah.
Wow.
And then the radiologist will just sign off on it once they see it. And yeah, it's
super.
It's getting close. I would say fourth quarter this year we'll release it.
And instability is probably the number one finding that we see with traumatic shear load to a spine.
Yeah, and you're the expert on that realm.
All I know is I know more and more about less and less. I know 3.5 millimeters of translation, 11 degrees of angular instability.
It's an important number.
But to have that from a radiologist actually signing off on it, that would be awesome.
I think it's...
Rather than... Because I get held accountable all the time. You're just a chiropractor.
Right.
And it's like, well, my background goes for years, almost 20 years of spinal biomechanics. You want to get into that? Let's get into it.
Right.
Let's talk about it.
Yeah.
One time I don't know if I've ever... I'll have to show you this video, but one time we even had a surgeon up. They opened up the spine and then showed the facet capsule tears with a flexion, with the patient in flexion, because that's where a neurosurgeon's going to do the surgery from the posterior side. They're going to put the neck in flexion, and then they had the patient open up and they showed the tears at 4 different levels. It was like, oh man, it's nasty. So the tears are there. Now, we couldn't identify it on MRI. You couldn't see it.
I'm working on that,
Now, are you
too.
Getting into flexion extension MRI, or what are you
We
guys
do
thinking,
those.
though?
We do them.
Yeah.
I will say it's pretty good. MRIs are not built for it because they are, you are recumbent in an MRI. It's difficult, but we do them. I think the data could be better that we get from it. We are working on a scan that shows these capsular tears.
Okay.
We've run people through. We've had the rads look at them. We're trying to determine, because it's all about the angle.
Yeah.
And so we're trying to determine how to get the best picture. But I think we'll have something next year on that, because it's really underreported.
Oh, it is.
And it's there.
It's
hard to see.
It's a false negative.
Yeah.
And because on flexion extension X-ray, I've seen it where it's like, man, you can see the gapping.
You can see the
between
gap
those two.
Yeah.
And then I've been in defense depositions and trials and stuff explaining it. Well, come on, you got to explain the difference between this and there's really no standardized, gapping or whatever. Hey, if it's over 3 millimeters or whatever, then it's
right.
But you can just see the difference between the gap at C5, C6 versus C2,
so you know
C3.
It's torn.
So there's a tear in there.
Mm-hmm.
And you can go over it and palpate with the patient. They're like, oh yeah. Right. And then they go into flexion, you just palpate.
Yep.
It's like, ooh, you could feel the instability. I'd love for there to be like a positive orthopedic test that's more indicative rather than maximum cervical compression or modified Sperlings or something like that. Where, I mean, modified Sperlings will be positive with a tear. And in fact, usually it's a sharp pain and they're like this, and you put a little pressure down on it and they're like, oh yeah, I feel that. And the odd thing is, oftentimes it'll be on the opposite side. It's like contralateral. They'll come down on, even though the facet on one side is torn, it's a bilateral facet tear. Because they'll say, oh no, I feel it over here on this side too. Which is really, because you've rotated it and you've extended it and then you compress it over the facet. Yeah. I'd love to talk to you guys more on that one.
Yeah, I think
that sounds cool.
It's interesting because yes, you see those findings on X-ray and you see gapping, and you're like, okay, I'm pretty sure that's going to be torn, but you can't see the ligaments. You can't see the soft tissue, and there's where MRI comes in. It's a soft tissue modality, so being able to see it on there and see it on X-ray and combining the two is a really, really good data to say, hey, this is an issue, and this is a result of trauma to your spine. Yeah.
Yeah, and then it's like, okay, so what's the next step? And now we've gotten into stem cell injection. I'd love for, instead of a fusion over the area, which is that video I'm talking about, is a fusion situation. Yeah. They fuse the area. Instead, it'd be awesome just to go in with a needle under video fluoroscopy and like, hey, we can put stem cell in here, try to regenerate the tissue.
Yes.
And then let's take another one, however many, 3 months from now. Right. Let's get an updated one. I think that'd be solid. I know insurance companies get a little upset about it because they're like, well, it's going to be multiple images and it's going to cost us a lot of money.
Right.
But then at the same time, the surgery was going to be $50,000 anyways for 3 levels of fusion.
Yeah.
So why not spend $10,000?
I know.
I think it could just drop the price, to be honest.
Right.
I think it's highly beneficial. That's my opinion, but I think it's huge.
And I think that's a good comparison because you do think about, well, this person, if they don't get surgery now, they're going to get it at some point because that spine's going to fall apart, basically.
Yeah, you're going to have degenerative arthrosis of the joints and spondylosis happening, and laminae are going to get total spondylotic. It's going to be awful.
Yeah.
It's going to be nasty.
Be better just to heal it.
And it increases it by 500%. Isn't that crazy? Like within the next 1 to 2 years, increases your risk of spondylosis by 500% when you have those tears. Yeah. So because it's got to lay down some calcium somewhere,
right?
And it's got to do it fast. And I've taken pre and post X-rays where I've seen the facet capsule is gapped. We'll take another one in about 3 months later to 6 months, and you'll start to see calcification, and you'll see the facet, the bone itself actually has that wave in it. You can see that it's trying to lay down more calcium it's doing its job. It's adapting to the situation. And that's the purpose of calcium, right? It's like Wolff's Law, and if you get Wolff's Law involved in that, and you get that calcium starting to pour in, and it's like, oh, we got to heal this damaged tissue. That's cool. But is there another way we can do it?
Right.
And that's where I love to have stem cell.
That's the thing.
We need to talk more on that. I want to hear. We have to have a follow-up with you.
Yeah. I would love to. We'll do that.
A year from now.
And we have all this new stuff we can talk about for sure. Yeah. Hopefully it's all up and running too. Yep. Yeah.
So one other question then, like with the screening side, what about colon? Do you know if do you have to go in for colonoscopy anymore, or would MRI be able to identify stuff like that?
It's not great.
No.
I mean, still
curious on it.
It's just the gold standard is the old way. There are virtual CT scans for colonoscopies, but have never gotten traction.
Really?
For several reasons. Just because mainly you end up getting a regular colonoscopy anyway after you get a CT, and if they find something, you have to go get a full colonoscopy. So, I think that industry, and I'm not an expert on that industry, but I think they've always stayed away from the advanced imaging stuff. But MRI is not superior to CT for that.
No, okay.
It will show you certain things, but CT is still what everybody uses. Well, not that. Plenty of other. We definitely want to maximize the MRI technology because there's no radiation with it, right? And I can tell you, since AI, we have 2 machines in Utah that are AI driven. Which is still a little rare to have AI-driven MRI machines. But when I say AI driven, that there's an AI software that exponentially creates a better image and time, because nobody wants to lay in an MRI machine for a long time. The older machines are slower. 3Ts, like the one we have at Viv, or we have a few around the state here, are much faster machines. So the patient's in there a shorter time. AI driven on top of that then cuts that time even more in half. So we can scan a low back in 7 minutes. Old days, 30 to 40 minutes. So a patient lays there for a brief amount of time, yeah, and which is really good, right? That's what that's awesome. The goal. And you're not sacrificing image quality. And you're getting great image quality. And so that world of advanced imaging, I always use the word exponential, because exponentially it is getting better almost annually now. It used to have big leaps every 5 or so years. Now it's every year, again, because AI has becoming a part of healthcare. And that technology, I think the MRI world, advanced imaging in general, in 5 years from now will be far different, far better.
Do you really?
Which is great.
That was
Detection.
one of my questions for you, was where do you think AI is coming in to
It's
play in this
huge.
whole thing?
It's huge.
I know for me, oftentimes I'll be like, you know what? It's a smaller patient. Can we get a few more slices in there? I mean, can we stop saying that, do you think, with AI? Or is it you still have to have the slices at a certain...
No, I think
gaps, slice and gap with an MRI.
I mean, I can say that there's a really good chance that you're going to get rid of a lot of sequences at some point.
Really?
Yeah, because AI has this incredible ability to predict what's going to be there.
Fill in what's
super crazy, and I couldn't begin to tell you how it does that exactly, but it's amazing, and I'm excited about that. I'm excited about having the technology.
I bet you are.
Yeah, it's cool.
I mean, you're going to get. I mean, one, from a business perspective, you're going to have more patients able to come in and get the imaging done versus like, it used to be 30, 40 minutes in that one machine.
Mm-hmm. Yep.
Man, 7 minutes for a lumbar. I didn't realize that.
Yeah, those machines are fast.
That's incredible.
And then the thing too is, if you really wanted to dial in, if you wanted to give a little more time for scans, you can actually get very, very microscopic on the images, meaning you can get such extreme detail because the machine's more powerful now with that AI software. So it has the ability to really, really, image enhancement is for me, I geek out on it, because when I see it, I'm like, I can't even believe the machines are producing these images. They're so microscopic that if I'm a really great practitioner and I want to know, every the very detail of any tear of anything, I can see it on there. Or in brain anatomy, the microscopic level of imaging is very important. Especially when it comes to traumatic brain injuries. Being able now to like dial in on ultra microscopic injuries to the brain is giving us a window into the injury we hadn't had before, which is really cool for these patients who suffer from TBI, and in the past we're just like, well, it'll go away someday, and it doesn't.
Yeah, it's not.
Yep.
Well, that would be that'd be a whole other avenue I'd love to explore. So like at Viv, what about TBI and MTBI?
Yeah, we use a company that post processes our images for TBI now, out of Canada, IMICA, and I'm a huge fan. They have an FDA cleared software that detects TBI so accurately, but not severe only, but also mild and moderate. So if I have a mild traumatic brain injury, in the past, a lot of times people just sort of blow it off and say, I've got brain fog, whatever, sometimes the rest of my life, or any other host of symptoms. And now this software has a great job of detecting any injuries to the axons at any level, and is able to scale it and say, this is outside of what normal should be for this brain.
So we can get that at Viv?
Get it at Viv.
Like an Andy scan?
That's the Andy scan.
Or Andy scan, I mean.
Yep.
Amica.
Yeah, and it's really, really reasonable from a cash pay perspective.
Really?
It's not a cheap scan, I will say that, but from a cash perspective, we made it very affordable.
Really?
Yeah.
Cool.
On purpose.
Because I can't tell you how many soccer players come in on the weekends and go, man, my bell got rung
Right.
over the weekend,
Yeah.
just so you know.
Yeah.
And it's like, that's your fourth.
Right.
You better go get checked out, man. Because I have seen that that was within this, well, I think it was about a month ago. And patient of mine did get her bell rung. It was pretty rough. And this is her 5th concussion.
Wow.
And to be honest, and she came in with glasses on and everything. And she had a difficult time even remembering her name.
Mm-hmm.
There was some definite cognitive problems going on here. And really, as a practitioner, you go, okay, so what insurance do you have? Where are you at? Because in my mind, I'm thinking, you need to go get your brain scanned. Gosh, a lot of practitioners don't move in that direction.
No.
You just kind of say, well, you know what? We can get you on some anti-nausea medication.
Right.
Go home, get some rest.
Right. Yeah.
I'd rather have some answers. And they want the answers too.
Yeah, I think that's a really good point. They want the answers, and honestly, years ago, MRI wasn't great to detect TBI, especially on anything less than severe. But now with this, the thing that you worry about with these multiple concussions, or even just one, is this process that it starts, which is neuroinflammation in the brain.
Yeah.
So now research is really going in this direction of what is long-term neuroinflammation cause, and they're starting to link it to these pathologies later, like the dementias, the Alzheimer's. Some of these pathologies that are showing up later in life are from this neuroinflammation phase that started possibly years earlier. Mm-hmm. So why not detect it early?
Yeah.
Get treatment for it, and then probably go through another round of detection, like imaging again, after some treatment, and see, has this neuroinflammation gone down, meaning my risk level of having issues later is much lower. I think that's where that world is heading right now with TBI.
Yeah, I think so too.
The long-term stuff.
So Vive, we can refer over there though and make it happen.
Yeah. Yep.
My goodness, you need to that needs to be blasted out from.
We will have a campaign just on concussion. Yeah.
You need to.
Yeah.
That's cool.
It's a huge passion of mine, that part.
Yeah. I mean, I see it all the time.
I'm sure you see it all the time.
All the time.
So common.
80% of the patients I see with exams, it's like, there's definitely head injury involved in this.
Yeah.
And whether it's sports or car crashes.
Yeah.
We see both sides. And and even work injuries too. I've seen it. Seen some pretty crazy ones. There was a guy out in, oh man, where was he at? What city is that? It's in Utah. Anyways, he was out working at a, it was like a mine. Man, what is the town? It's over in it's in the Uintas. It seems like it starts with a V. Why am I thinking V?
Isn't it Vernal?
Vernal.
Okay.
There you go. That's it. So he's in Vernal, and a pipe exploded at the site that he was working at, and the pipe brushed half his body, contacting the head, but it came at him. Who knows what speed?
Oh yeah.
It just almost took off his leg, just shattered the leg. I mean, just a total fracture to the femur. It was a huge pipe though, but it did catch his head too. There was head injury involved. There was facial fracture. He didn't even see it coming at him. I mean, it just blasted him. And then you look at the truck that was I think it was 50 yards behind him, that it impacted the side of the truck too. I mean, just took out the whole side of the truck. It was crazy.
Wow. He's lucky to be alive.
You're lucky to be alive, brother. I mean, he had total functional loss of his left leg. It was a laundry list, and they just wanted kind of a work comp impairment evaluation, a PPD evaluation on him. Anyways, but at that time, that was years ago. That was probably 10 years ago.
Oh.
But it'd been cool to send in and really get an analysis of the brain, where he was at. Instead, we got a neuropsychologist involved just to kind of do a paper pencil eval. Yeah. But it didn't really didn't give a lot of data, where it would have been better to have more of an MRI of the brain. That would have been awesome. I've had I've had thousands of evaluations where I'm like, man, you need an MRI on that. Right. So
I'm glad you embrace it.
Oh, I embrace it. That's my life.
I know you do. I do know you do.
Because when I look at them and I find the answers, and I'm like, man, here's the problem. I know the direction to go, right? I know the diagnosis, I know the prognosis, I know the treatment plan.
Yeah.
It just spells it out. Boom.
Yeah, you're right.
Game on. Let's treat the patient now.
Yeah.
So we need more practitioners in the chiro world and the PT world, because usually now with physical therapists in Utah, I mean, they're primary care physicians.
They are. Just happened.
Just happened here. So they need to have that MRI. They need to have that side of them where they're like, we need an MRI, or we need at least flexion extension radiographs.
Yeah.
And start with that.
Yep.
And then move into an MRI. So I don't know. I'm pushing it for you. I promise I
appreciate
am.
that.
Like, I'm trying to get into these universities here, and I'm like, okay, guys, this is the direction you guys need to go. So Rocky Mountain University, they're calling me right now.
Oh, yeah.
And their PT program. And
that'd be really
I'm
good.
supposed to be meeting with them in September.
Get involved with those guys. That's fantastic.
It'd be awesome. And I think we should have a whole MRI program. Like, hey, guys, this is what you... They don't have it. They wouldn't be able to fit it into their curriculum because it's already too much. But they could have a weekend course on it, And, hey, I went to stuff all the time in chiro school.
Right.
20-something years
on the
ago.
weekend stuff, huh?
Yeah. I'd go and, like, especially on whiplash and trauma.
Right.
Super helpful.
Mm-hmm.
Okay. Awesome. I think you answered all my questions.
Cool. Love
and then, okay. So then how does everybody reach out to you now? So with Vive, how do they get a hold of...
Vive is easy.
All the physicians that we have on here.
Yep.
Yeah, let's give some rundown on...
So the physicians can... I mean, obviously we take patients who want to call in or get online and schedule. That's one avenue. But we also are going to see traditional patients there. No health insurance, though. We don't take any health insurance at that site because we can't. Since we're offering cash pay... to be able to achieve the pricing we wanted, we couldn't follow a lot of the healthcare rules. So we don't take any health insurance, but any physician can still order an MRI and send to that site and get the discounted rate, etc., or get some of these more, I call them proprietary scans. That's a different avenue for them. And we also see personal injury patients there too. Traditionally,
you're going to do personal injury there too.
Yeah, I didn't want to take the site away from. I wanted still people to have access that from our normal referring community. The only thing I had to eliminate was the health insurance part. So, but again, the pricing's reasonable. Viv Radiology, vivradiology.com is the website.
Okay.
Which is not live yet. We'll be live on the 18th.
So vivradiology.com.
Yep. And then it'll take them to the scheduling, and they can schedule online. I mean, if a physician wants to use it with his patient sitting there, they could do that, and they don't even have to call. They just get online, they pick a time and a date, and we get them in.
I'm excited about that.
Yeah, I am too.
We need to come over and check it out.
Right. Yeah, I expect speed bumps. It's a new model. It's a new project. Super good people involved, though. Like our local team, which you're aware of, are fantastic. Best operations.
Well, they're awesome.
Yeah,
we've loved them. So everything about them. So what we'll have to do is get all the chiros and the PTs and I mean those are the ones that are in the MD side. Nothing against medicine at all, but a lot of them will call us and say, what do you think we should do? And so then it comes back down to the chiro, MSK injury, or whatever. What do you think we should do? I'm done with the injection treatment. Next step, and it's like, well, have they had any imaging yet? And they're like, no MRI, no. Okay, so where should we send them? And that's usually their question to us.
Yeah.
And a lot of the medical doctors I know that we work with are so busy, they're so swamped on just
absolutely.
Treatment. Like they're 5 minutes with the patient. To next patient, next patient. So, my heart goes out to them because they're super busy. Yeah. So it's like, we need to have the chiros, the PTs. You spend a little more time with the patients, and we're able to get the referrals done. So we'll make that happen. I need to have that on our program. Okay.
Yep.
I love it. Well, you're awesome.
Well, you are too. I appreciate you inviting me to do this. This is cool. Cool setup. Love it.
Yeah. Thank you. Yeah, it's great having you here. And then if all of our patients would have any questions on Vive, so vivradiology.com, right?
Yep, that's it.
And then reach out to that. Thanks for being on the show.
Thank you.
Have an awesome day.
You too.